Welcome to the ECF Podcast. My name is Mrs. Nasru. I'm your host. In the last episode, we were able to learn something about cancer, what it is, the causes, and some of the preventive measures. In today's episode, we shall see how you can take care of a cancer patient. Speaking from experience, taking care of a cancer patient is not an easy task. It comes with a lot of challenges ranging from physical, emotional, mental, and financial problems. But first, the information in today's episode is not meant to discourage you from taking care of your loved one, but to prepare you for what you are most likely to encounter during the process of taking care of that family member or friend who has just been diagnosed with cancer. Secondly, the information provided here should not in any way replace the instructions provided by the healthcare team that is handling your patient. Your job as a caretaker starts immediately your patient has been diagnosed with cancer. Your patient may find the news really hard to accept and may even refuse to take the medication. Yet this is the critical moment in the management of the disease, because if cancer is not managed immediately, it is most likely to advance to another stage, hence complicating its management. Your immediate duty is to talk to the patient and make sure that they understand. You can also involve other family members or the healthcare team to make sure that the patient is started on treatment. If the patient is to be transferred from the hospital to their home, make sure that the healthcare team provides clear instructions on how to administer drugs, how to dress the wounds, or how to move the patient, and what to do in case of emergencies. And if you have been escorted by a home care nurse, the nurse should be able to assess the situation and advise accordingly. The nurse may also suggest a few changes in the home arrangement to ensure that danger to the patient is minimized. Ask if the doctor recommends any type of food or food supplements and what kind of foods to avoid. Also ask about the medication, whether to expect any side effects, whether the drug is to be taken before food, with food, or after food. Ask for what to do if the patient experiences extreme pain. The doctor may suggest a few things, for example, applying a warm cloth or the use of ice packs to relieve pain. Write down the date for the next doctor's appointment or home care follow-up. While at home, you are in control. Prepare the favorite food and always get their opinion before you prepare any foods. Remember, cancer patients can have low appetite and sometimes refuse to eat the food you have prepared. Please try to understand, as this could be a result of pain, side effects from the drugs, or simply stress. Prepare vegetables and fruits and make juice if the patient is having a hard time eating solid food. Don't keep your patient in bed if they can move, and if they can't walk, transfer them into a wheelchair, but don't do this alone for heavy patients, as you may end up hurting yourself. Always take your patient for a walk, exercise together, eat out sometimes, have some fun together, as this will help you and your patient to spend some time away from thinking about the illness. Help your patient brush their teeth, apply makeup, or take a bath. And if they feel uncomfortable with you helping them take a bath, don't force it. Get another person to help if you see them struggling to take a bath by themselves. Now, the disease may advance and home care is no longer helpful. Don't blame yourself. You have done more than enough, and it is time for the professional health care team to take over some of the responsibilities. And this will help you and your loved ones spend some quality time together. Now, with good health care, the patient may get well and resume their normal life, and this is job well done. But what if the patient dies? Now, losing a person you really care for is so challenging, and it is too hard to live with. So many changes happen all of a sudden. Some people even go into shock. Others go into emotional distress and start thinking of hurting themselves, or fighting with the people they love, or feel anger towards other people such as the doctors and nurses. But remember, none of these things will ever bring your loved one back. This is the fact we must all accept. And no one really enjoys seeing their loved one suffering with pain. And it is better to take it that perhaps your loved one is resting and is no longer in pain. As we conclude today's episode, we have seen that the whole process is likely to exert too much pressure on you. Some caretakers are the sole funders of the whole treatment process, which affects them financially. Others end up losing their jobs or even drop out of school to be able to take care of their loved one. As a caretaker, you may experience a number of challenges ranging from depression, stress, frustration, loneliness as you are always occupied and missing out on your usual social activities, and fear that the loved one could die. But as a caretaker, don't expect to be perfect, and don't do things alone. Always work with the healthcare team. Involve other family members and friends, or get respite home care services. Trust me, you can't take care of a patient 24 hours a day for months or years alone and remain sane. Let another family member take over so you can take breaks or small vacations. And if you are so depressed, try taking deep breath or meditations, or talk to someone about it. And if unfortunately the patient dies, just know it is not your fault. And if you can't take it, try talking to a counselor. Stay away from smoking and alcohol, and try to be patient, as this will eventually come to pass. And finally, look after yourself. Eat healthy, exercise regularly, and have enough sleep. Thank you again for listening. You can leave us a review and tell us what you think. Don't forget to follow us so that you can get notified every time we post a new episode. My name is Musasi Zinasu from Eliminate Cancer Foundation, Uganda. See you on the next episode.